So here's one of our key performance indicators.
Some people love sports statistics.
This tells me that in terms of heart attacks, people are being treated quickly in the field and they're going to the appropriate hospital.
Mike Lopez loves emergency medical statistics. As the Spokane Fire Department's Integrated Medical Services Manager, he knows statistics can save lives.
Providing the information to our people, it allows them to see how they're doing.
Mike takes data about fire department calls and develops training to help crews in the field be the best they can be.
Through focused education, by April we were at 100% of the patients who should have gone to the level 1 went to the level 1.
The numbers also tell Mike which patients dial 911 frequently. They are usually the underserved, often Spokane's homeless, who need things such as basic health care or social services, more than a fire truck. Mike is able to connect them to community resources.
And so by identifying those people who are high utilizers of the system, we can then kind of rally the troops, if you will, coordinate activities, and get those folks the resources that they need.
He's able to always connect it back to, that's a person, it's not a number, it's not a case, it's not something we were dispatched to and they matter. And he always has that approach when he interacts with folks.
When a disaster hits, such as the windstorm last fall that left more than 200,000 people without power, the statistics Mike has so meticulously analyzed become priceless. Because of Mike's information, the fire department and its partners were able to check on the communities most vulnerable, most affected by the storm.
Then was able to take that information and then either call on the telephone and talk to the individual to make sure that they were doing okay, or if I couldn't get a hold of them, then I would forward that to our communications center, and our communications specialists would then assign an engine company or one of our alternative response units, or in some cases our medical service officers, to go out and physically check with the individual to see if they had needs, to make sure that they were physically okay, and if they needed resources, then let's get them either into a shelter or get them the resources that they need.
He was really good at knowing the areas where the most vulnerable populations were, to be able to hone in on, this neighborhood is a high utilizing neighborhood and the likelihood that they're, potentially low income. So when their power goes out, all of their food goes away. So they don't have access to resources. And who's going to check on them if they can't watch TV to see the news updates of when they're going to get power or where to go to access services. So he really was able to connect those two pieces together and find the players in the community to fit that hole that needed to be filled.
This community is healthier and safer because Mike Lopez has a combination you don't often find: a head for numbers and a heart for people.